All right, let's do an overview of glaucoma medications. So glaucoma, I'm going to go over the medications related to chronic glaucoma and acute angle closure glaucoma. And I won't get into all the fine details, but this will at least give you kind of an overview, like I said, have a general idea about the medications and the mechanisms and kind of what to do in each case. All right, so what the heck is glaucoma? It's increased pressure inside the eyeball. How do you diagnose it? Well, there's a couple different types of devices that are used to measure the pressure in the eye. And then if you're really old school, you might just push on the eye and see how firm it is. Some old ER docs talk about doing that. It should feel like a grape if it's got a normal pressure. All right, so what about chronic glaucoma? Well, basically there's, as I understand it, I'm not an ophthalmologist. I'm a PA who does emergency medicine. I've done some family practice and urgent care. But as I understand it, there's 3 or 4 types of eye drops that are used for chronic glaucoma. And what are they, or what are the categories and why? Well, they may include your carbonic anhydrase inhibitors, and those ones decrease the production of the aqueous humor. So less fluid, less liquid in the eye, so less pressure. And those have names that end in amide or maybe zolamide in at least some of the cases. So that's like brinzolamide and dorzolamide. So those are CA inhibitors or carbonic anhydrase inhibitors, and they decrease production of aqueous humor. Also, a beta blocker, specifically timolol, is the eye drop beta blocker. And what does a beta blocker do? Well, I guess it improves drainage, but it might also decrease production of the aqueous humor. And then you can potentially use, and I don't know how aggressively they use these, but pilocarpine, that's the parasympathetic stimulant or agonist. And so what that's going to do is constrict the eye, and so that'll allow more drainage of the fluid. But I was just thinking as I read this, it probably messes with their vision, so I doubt they use that very aggressively, maybe at night or something. But it is listed here in one of my resources as a treatment for chronic glaucoma. So why does the parasympathetic stimulation help? Well, if you constrict the eye, it kind of opens up the little canals where the aqueous humor drains in the periphery. So what would be different or the same about acute angle closure glaucoma versus the chronic glaucoma that we just talked about? Well, it's basically the same, except, of course, it's more of a quick, short-term treatment, and you don't just use eye drops. You may also use like some IV or even PO medications. So specifically, what am I talking about? Well, you in theory, from my perspective, I think you could probably use all those same eye drops that I just mentioned. But in addition to that, you might use IV versions of the carbonic anhydrase inhibitors, and that is acetazolamide. Acetazolamide is one of those. And there's also a topical alpha agonist, which helps, and that is called apraclonidine, at least one of them. And so you have, like I said, a couple other things, just some slight differences. So to kind of recap or to summarize regarding the acute angle closure, once you diagnose it, which, with a tonometer or something, if the pressure's over about 30, you'd be concerned for that. So the beta blocker, timolol, the pilocarpine, 1 or 2 doses. And so remember, that's the parasympathetic. It's going to constrict. And then you can give the IV acetazolamide. I don't see why you wouldn't use the CA inhibitor drops also, but for some reason they don't tend to list those in the resources I'm looking at as a treatment for acute glaucoma. Sometimes they'll use IV mannitol as well, because that's the same idea. It's not the same idea, but it's going to have an osmotic effect to maybe reduce the volume of aqueous humor. And so I think those are all the typical treatments. There are others that sometimes get mentioned, like steroids and things. But anyway, if you had acute angle closure glaucoma, you'd be doing this treatment in consultation with an ophthalmologist. And so you'd talk to them and kind of decide. But if you wanted to get something started, it's good to at least have an idea. So again, it's so like timolol, 0.5%, 1 drop to get started in acute glaucoma. The apraclonidine, 1%, you could do a 1 drop. The acetazolamide IV, you could do like 500 milligrams. Mannitol, 1 or 2 grams IV. And the pilocarpine, 1% or 2%, and 1 drop every 15 minutes for 2 doses. So that's some stuff to get you started. In other words, if you needed to, well, if you wanted to be like, well, let's do at least some of the treatment, while we're waiting for the ophthalmologist to call, or, but probably you can wait for them to call unless it's going to take forever, or if you need to transfer the patient or whatever. It would give you some ideas of some stuff to do. All right. So that's just like a general idea about glaucoma. Let's see, was there anything I missed? So yeah, like I said, some of those things will decrease production of aqueous humor. Some of them will allow better drainage of it. The alpha blocker, you kind of hear different things, but what does an alpha blocker do? One of the things it does is constrict blood vessels, right? So that might play a role, but I'm reading here that it says it blocks production of aqueous humor. So I don't know exactly how it does that, but that's what the book says. All right, so there you go. Glaucoma medication overview. Hope that helps.